for those who have been here throughout the day, obviously you've been used to Jono's face, and it's me who's introducing this one. So I'm George, I'm a paramedic who currently works in the southwest of England, in the Gloucestershire sort of area. I'm relatively newly qualified, but I thought I'd introduce this one as my mum is presenting this presentation today. She's been very good in getting involved with this. I sort of roped her in on the side. My mum's a midwife by background, currently working as a consultant midwife at the University Hospitals of North Midlands, and she's going to be talking to us about a career in midwifery, as well as some of the other roles available within the profession and the world of midwifery in general. So, Mum, are you ready to go?
I'm ready, George, thank you.
Good stuff. So I'll hand you over. Thank you very much for being here today. I'll let you introduce yourself further, but it's great to have you on board, and good luck with the rest of the session.
Thank you very much, George. That's a first for us, never been introduced or presented, introduced by or presented to my son, so that's lovely. Thanks, George. I'm really happy to be involved. So hello, everybody. I hope you've had a great day. So as you've heard, my name's Dr. Angela Hancock, and I'm a consultant midwife in public health at the University Hospital of North Midlands. It's a great privilege to have been asked to speak to you today about my experiences of the world of midwifery in the UK, at least, not the whole world, but I'd like to thank the organisers for inviting me here today, and also to you for taking the time to listen. So I'm just going to explain the outline of the presentation. So what I'll be doing first of all is just explaining, or just having an overview and providing some links to what is a midwife, what the role entails. I then thought it'd be quite important to just give you a little bit of the context of UK maternity services. So just to highlight some key reports and policy documents that are driving change and improvements in maternity services at the moment. I'm then going to give you a whistle-stop tour of my own midwifery career, just to provide some insight into the role and the opportunities that I've had and created throughout my career, which have led me to my current position as a consultant midwife. I'm then going to focus on the roles and some of the routes into the profession, and provide some tips as well on preparing applications, getting ready for interviews, and how to consider your life and work experiences as relevant to midwifery. And then finally, I'm going to show you a short film thanks to my daughter Lily, who has made a little film out of video clips that have been provided from my very generous and brave colleagues. I don't think we'll be getting an Oscar nomination, but hopefully it'll be nice for you to hear about various roles in maternity care that are probably slightly outside of what you might be expecting that midwives get up to on a day-to-day basis. There will be time at the end of the presentation if you want to add your questions. I'm more than happy to answer those if I can. And I've just put 2 yellow stars at the top of this slide, and that's to remind me to tell you that throughout the presentation I've highlighted some links and some key documents that you may wish to access, just to help you get a deeper insight into maternity care, and also to help you prepare for those applications and interviews. First of all, what is a midwife? Well, this might seem like a strange question. You might assume that people attending a midwifery talk would know what a midwife is, but I've been quite surprised over the years that people who've attended for interviews for midwifery programmes have often had a very limited and superficial view of what a midwife does. We'll talk a little bit more as we go through the presentation, but for the start I just wanted to provide a framework of the role. So we know that midwives are involved with supporting women through the birth of their babies, but there's a lot more that's entailed in the role, with the midwife being the first and main contact for the woman throughout a pregnancy, throughout labour, and in the early postnatal period when they then hand over to the health visitor. So I've put you a couple of links on there which will take you to lots of information about midwifery and some of the other careers that you might want to explore, and also some more videos so that you can hear people talking about their careers. I think it's really valuable, really important that you try and find out as much as possible about what midwives do, so that you really understand the role and that you're able to consider whether that's right for you, and you're able to convince people at your interview that this is the right career and that you've given it lots of thought. I think you're already making a great start by attending events like today. These are the kind of events that will increase your knowledge and insight and inform the career choices that you subsequently make. So hopefully today will just get you started. So first of all, just a little bit of the context of maternity services in which we're practicing today. This is important to know to understand the role, and also when you're making applications and preparing for interviews. So the stars on this page just highlight the 2 key documents that you might want to look at, but there are others on there that you can gain insight from as well. So Better Births was published in 2016. And this is the report of the National Maternity Review that was done as part of the NHS long-term plan. And this sets out a vision for maternity services in England that are safe and personalised, that put the needs of the woman, her baby and her family at the heart of care. You can see the woman there in the centre of the screen. And care is provided by staff who are supported to deliver high quality care, which is continuously improving. And what we'd really like is, with that woman at the heart of the care, is for her to have continuity of care during her maternity journey. So before, during and after the birth, because this has been shown to lead to better outcomes for both the woman and the baby. It gives a more positive and personalised experience, and also for the midwives who are working in this model of care, often it's more a satisfying way of working. So the next slide does provide a video just looking specifically at continuity of care, which I won't show you. You can access that in your own time. Other key documents relating to safety are the Saving Babies' Lives Care Bundle, and we're currently working with version 2. Which is shown here, and these help us to focus care on 5 elements, which we're hoping that will help us to halve the rate of preterm births, stillbirths, brain injuries that occur during or soon after birth by 2025. So all these initiatives and the Better Births vision is being driven through Maternity Transformation Programme, and really safety is the golden thread that's running through this drive. The LMNS stands for the Local Maternity and Neonatal System, and they're the people sort of outside of the provider trusts who support us. So there are midwives, project managers, lots of people with links out to the CCG and wider healthcare community who help us join together and plan our next steps. Really important as well is co-production with service users, women and families who've used the service. So this is done primarily through the Maternity Voices Partnership, and this is mums recently who've used the service who join in to contribute to discussions and meetings and give their opinions on how the services can be tailored to their needs. There's then local leadership in the provider trusts, people like myself who are working on initiatives sort of reducing smoking in pregnancy, working with the Saving Babies' Lives Midwife to implement some of the changes there, and supporting those well-trained and confident teams to deliver this vision. Okay, so that's the video that will just provide you a little bit more detail about midwifery continuity of care. And lots of midwifery programmes that are being developed are developing, trying to develop their programmes with continuity of care in mind. So this will be a theme that runs through those educational programmes as well. So what I'd like to do next is just give you a little overview of my career to date. So this is my career path. The blue circles on the left-hand side represent my key achievements, and the pink circles on the right with the text on the right are the posts that I've held. So first of all, I think it was inevitable that I would have a career in healthcare, because as a child I only ever dressed up in a nurse's uniform. I also seem to know way more than my 5-year-old peers about the childbearing process, and I sort of attribute this to spending a lot of time with my grandma, who had 10 children herself, and therefore I was constantly surrounded by aunties who were pregnant or breastfeeding. Another key influence was the story that I grew up hearing about my mum's experience of stillbirth at term with her first baby. And unfortunately, it was my mum's recollection of unkind words and attitudes that stuck with me most. There is a saying by Maya Angelou that said, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. And I think I learned from a very early age that through my mum's experience that actually childbearing women will remember all three. And this has greatly influenced the kind of midwife that I've always strived to be. So in November 1987, I started my nurse training, and at the time this was the only way that I could become a midwife, was to train as a nurse for 3 years and complete 18 months additional training to become a midwife. So I did the 2 courses in quick succession, and I qualified as a midwife in 1993, and I became what we call a rotational midwife, and this is a pattern that commonly happens today where newly qualified midwives complete a preceptorship programme and rotate through all the areas of maternity care to gain experience and increase the confidence. So it was also around this time actually that direct entry route to midwifery also became available, and we're more familiar with this today. So there were a few other things that happened in 1993 which were pivotal to my career, and one was the birth of the World Wide Web. And the other was the publication of an article in the Nursing Times which said midwives could leave perineal wounds unsutured. So in 1993, it was quite difficult to find evidence to check the theory about leaving tears unsutured. I was able to request literature searches from the RCM and MIDAS, but I failed to find any evidence to support not suturing perineal tears. But being very determined and leaving no stone unturned, I found the address of an author I'd seen on one of the articles I'd been reading, and I wrote to her, and that was Jennifer Sleep. And she sent me back a few words on a compliment slip, saying that the reason I'd found no evidence was because there wasn't any. And she also added another sentence which said, "Well done, midwifery needs more questioning practitioners like you." And those words were a complete inspiration to me and ignited my passion for perineal care, but also for always looking for evidence to support not only my practice, but the practice of others. So I got involved with improving perineal care, and as a relatively new midwife in 1995, I successfully led a change in practice relating to the materials that were used for perineal care. And around this time, I also became a core midwife on Delivery Suite, and then went on to become a Delivery Suite coordinator in 1997. I went on to finish a part-time degree, and I also had 2 children of my own, one of whom you've met today, George, born in 2000, and Lily in 2003. And then when I came back from maternity leave in 2004, I led another change in practice relating to the methods of perineal repair. And by this time, I was being supported by a midwife who I'd met on a train. And she was from a neighbouring hospital, and she'd conducted a large randomised controlled trial into the best methods and materials used for perineal repair. And it's her research that we still base our practice on today. And she subsequently supported me to implement a midwife-led clinic in 2008 for women with complex perineal trauma. And by then I was a practice development midwife. I was involved with other service improvements, and it was actually working on a service improvement project to implement some of the recommendations from the Saving Mothers' Lives confidential inquiries into maternal deaths to use early warning scores alongside physiological monitoring. And it was working with that nurse consultant that led me to setting my sights on being a consultant midwife myself. Inevitably, it was going to take a few years, and there were a few bumps in the road to navigate before I would actually get there. But to develop skills for this role that I'm in now, and also to answer a few questions for which I couldn't find any evidence. So obviously throughout my career, I'd always managed to find evidence or no evidence to support practice. In 2008, I was faced with a conundrum that I couldn't find any evidence of how to fix. And this was about making decisions about blood loss at childbirth. How did we diagnose PPH? And my concerns were that we seemed to be missing the diagnosis quite a lot. So I went on to study for a master's in research, and then ultimately got funded to do a PhD through the National Institute for Health Research. And this was fully funded, so they funded my salary and the research costs to explore clinical decision making during blood loss. So around the time I've been a few posts as a lecturer in between doing my doctoral research and working at hospitals in Manchester and Liverpool to do that research. I've then been able to combine all those skills that I've gained as a clinician and the research skills and education to develop a maternity board game in 2020. So I was quite proud of that, and that's currently being peer reviewed and tested at the moment. And that's again to promote teamwork in skills and communication. But it was an extra special moment in March this year when I secured my post as a consultant midwife in public health. I'd finally made that last rung of the ladder, so I was really pleased. Okay. So that's my career path. So now we start on yours, and this slide I'm not going to read through that, but this just gives you a little bit of insight into all the other health professionals that contribute to maternity care. So yes, we know about midwives, but we work in a multidisciplinary team. So this slide just gives you an overview of the other staff you would work with, and also some other roles that you might want to consider. But I'm just going to focus on a few key roles, so maternity support workers and midwives. The maternity support workers, they work under the supervision of a registered midwife, and many MSWs hold a variety of specialist roles, and I'm fortunate that some of them have been willing to speak on the little film that I'll show you later. It's a really exciting time for MSWs. They do a really fantastic job, and the role is currently being developed, so there's a national framework that's being piloted and rolled out at the moment, and this will help to standardise the role, give defined competencies and education and career framework. And this will also provide opportunities for wider access into maternity training, including through the apprenticeship routes. So this might be a way in for people who've not got those traditional qualifications that universities are expecting. But a lot of our maternity support workers have achieved great things in their roles and are very specialised in the care that they give. So obviously we're talking about midwives today as well. So midwifery, as you would expect, is the largest profession in the core maternity workforce. And there are things going on at the moment which is really good to people who are interested in getting into the profession. So there's work going on to increase midwifery training placements. We want to increase the numbers of people being retained in training and transitioning from training into newly qualified midwifery posts. We're trying to improve retention and also reduce non-retirement attrition, and we're doing this by certainly locally by developing roles, so educational support roles, pastoral roles, so that midwives are as supported as possible when they embark on newly qualified practice. And there are also some schemes for midwives who may have left the profession to return to practice, and there's more universities offering those kind of programs. So lots of people will be familiar with the direct entry route to midwifery, pre-registration midwifery degrees. So that's what we've become very familiar with, certainly through my career. And you'll probably be aware that most universities will want you to have at least 5 GCSEs at grades 9 to 4 or C or above if you've done them previously. And these will typically need to include maths and English and possibly a science subject. Not all universities need you to have a science, and some that do might take you anyway if you've done fantastic in your other subjects. They'll think you've got the calibre to acquire the science knowledge that you need. And for degree entry, you'll need 2 or 3 A levels or equivalent qualifications. It's really exciting at the moment to know that apprenticeships are being developed, and there's a link here which hopefully will work when you receive the PowerPoint. So the link's there for you to explore that in a bit more detail. And also shortened courses. So that was my route into midwifery, was I trained to be a nurse, and then I did what we call a short course. And these have really waned over the recent years, and they went down to just a handful or a couple of universities offering these courses. But this link will provide you with, I found 19 courses on there throughout the country for universities that are offering post-registration training as a midwife to people already trained as nurses. So this is a fantastic opportunity. You can find the opportunities to study for another undergraduate degree or postgraduate diplomas or master's degrees. So that's really widening the opportunities there. Just pop this slide in as well, because I think people sometimes overlook the neonatal unit. So people who are sort of more focused on providing care for the babies rather than the mothers and the babies in utero might want to consider a neonatal nurse career. So I've just popped this in there for information. So neonatal nurses are highly skilled intensive care nurses, and they care for babies from 23 weeks gestation up to 44 with a variety of complex needs. And neonatal nurses as well can work in the hospital or community supporting those babies after discharge. So most neonatal nurses have either trained as an adult nurse, a child nurse or a midwife before then doing additional courses to transfer into neonatal nursing. And then just two other roles I've popped on there: healthcare assistants, so just slightly different grades and responsibilities to the maternity support workers, and also newborn hearing screeners as well. So just want to mention to you, this is important for understanding the role of the midwife and also for your discussions at your interviews. So you probably already know that midwives are registered with the Nursing and Midwifery Council, and we're also regulated by them. So documents that you can access which will help you understand the role of the midwife would be the standards of proficiency for midwives. There's a range of documents. There are the standards of midwifery education as well, because the NMC dictate what training is provided. So this will really help you understand what a midwife needs to be able to do, and therefore what's within the scope of a midwife. We work to the code, which is our professional standards of practice and behaviour, and we have to comply with these standards when we're on and off duty. And the code is divided into 4 themes: so prioritising people, practising effectively, preserving safety, and promoting professionalism and trust. So it's quite a small document, but again, really good to have some insight into that when you're going for your interviews. And then to be aware that every 3 years, anybody on the NMC register needs to revalidate and show evidence that they've kept up to date with their clinical hours and also their educational development. So in terms of experience applications and interviews, I think the most important thing that really stands out is people who've got an absolute passion for wanting to be a midwife. So you can really feel that in an interview. And I think the best way that you can do that is to really understand the role and to understand that that role's right for you. Obviously, it's difficult in a global pandemic to gain experience in the maternity setting. It's probably quite impossible at the moment, but so it's about having a think about your transferable skills. So if somebody said to me, oh, well, all I've done is worked on customer service in Asda, and I'm like, brilliant, customer service, absolutely fantastic. So it's about looking at those jobs, roles, volunteering experiences you've had, and just applying those. So if you understand the role of the midwife, then you can explain that all that sensitive communication that you've had to do in Asda with people of all ages, young and old. You've diffused complex situations. You've dealt with people compassionately when they've been upset or frustrated. So you can use all your experiences and transfer those skills. So in your applications, it's about looking what I've done and telling the person who's reading that form how that applies to midwifery, and then that helps to explain that you understand the role. And you'll probably be aware of the 6 C's, that it would be, it's good to demonstrate all of these things. So the compassion we've talked about, the communication, really important. Being able to work independently as part of a team under pressure, etc. So I think what you really need to allow yourself is time. So time to write that personal statement, go away, come back with fresh eyes, edit it a bit more. It's really important to put that time in, because midwifery is a very oversubscribed course, so we get lots of applicants in relation to the number of places that are available. So it's really important that you stand out, that you've chosen the right career path for you, and that you make that obvious in that personal statement. Okay, so I'm just going to give you a minute now to read this little verse. This is the end of my presentation, and I'd just like you to admire some babies that mums from the Maternity Voices Partnership have allowed me to share with you. Okay, everybody, thank you for listening. That's the end of my presentation, and what I've got now is a video to share with you that my colleagues have very generously recorded themselves and allowed me to share. I'll just stop sharing my screen and then we can find our way back.
Hi, my name's Caroline. I am a bereavement specialist midwife at University Hospital of North Midlands. I chose to be a midwife after being inspired at a careers event at school. I've been a midwife now for nearly 22 years and really enjoyed that during my career, looking after bereaved families. So when the opportunity came up to apply for the bereavement specialist midwife, I jumped at it. Some of the challenges I've faced during my career, complexities of the women who lose their babies and the red tape that surrounds the bereavement, things that make it worthwhile, so making a difference and the support network that we provide for our bereaved families. The extra skills I've gained during my career are I'm an IP trained midwife, which means that I can perform the newborn infant physical examination. I'm also a trained scrub midwife, which means that I can assist the doctors during their theatre cases. Inspirations for the future, really just to keep improving the service that we provide for our bereaved families here at University Hospital of North Midlands, and to continue making a difference.
Hi everybody, my name's Caroline Cunningham. I'm a midwife working in Liverpool. I qualified as a midwife in 2007, so 14 years ago now. I'd always known, I think sort of in my teenage years and early adulthood, that I would be involved in some kind of healthcare professional role. It's just sort of in my nature. I enjoy talking to people, caring, and obviously the medical side of things. And I initially thought that nursing might be my chosen profession. And then as the years went on, I found out more about midwifery and realised that actually that was probably most likely the best career path for me. I currently work as a research midwife at Liverpool Women's Hospital, but I previously worked in a clinical capacity in other trusts in the Northwest, working on all areas of maternity care, so delivery suite, antenatal and postnatal wards. More recently as well, I've been working for the last 18 months or so on a multiple pregnancy clinic at Liverpool Women's Hospital, which has involved me providing antenatal care to women expecting multiple pregnancies, so twins, triplets, etc. These are more complicated pregnancies, so often need a more expert level of knowledge and care. So helping these ladies plan for birth, plan for the arrival of their babies, and just lots of education and TLC, etc. along the way. My research role I've been doing for several years now. I work with a great team of other research midwives, and we work on a National Institute for Health research portfolio, whereby we focus on recruiting people to studies and setting up studies covering a breadth of areas in maternity care. Like many other people, I experience the challenges of working in the NHS. Despite the challenges that we face, resources being a big one, staffing being a big one, I can definitely say from a maternity perspective, midwives are a great team of people to work within, a very supportive a group of individuals. The feeling that you get when you provide good care to somebody or excellent care to somebody, and that you've made a difference in a pregnant woman's life or a woman who's recently delivered life, and a thank you from them, and the simple appreciation that you've done something to make their life and their journey a little bit better or a little bit easier, is just all the thanks you need and what you need to pick you up when you might be feeling a bit down or when you are feeling the pulls of those challenges. Challenges will always be there, I think, in one form or the other, but I've survived this long, so hopefully I've got a bit longer to go yet.
Hello, my name is Christy. I've worked for the Trust for the past 17 years in the maternity. I started as a Band 2 healthcare, and after 4 years I went on to do a 2-year training course to become a Band 3 in perioperative scrub. This meant that I would scrub for all obstetric cases within the maternity theatres. This gave me the title of an OTMSW, which is an obstetric theatre maternity support worker. I have now been qualified for 13 years. I chose this career as it's something that I always found interesting, but never found myself worthy of doing it. I have faced many challenges through my career, with highs and lows, but I have found that getting support from your team is the best advice. My aspirations for the future is to continue to give the best care possible for all patients, relatives and staff. I hopefully carry out my role in the maternity until my retirement.
Hi, my name is Dr. Alison Cook, and I'm the Assistant Director of Nursing, Midwifery and Allied Health Professional Research and Innovation at the University Hospitals of North Midlands. I also hold an Honorary Senior Lecturer position at Keele University and an Honorary Lecturer position at the University of Manchester. I have a Masters in Research and I also have a PhD. So I'm a direct entry midwife by background, and I was inspired to embark on this career because I was deeply touched by the care that I received from one of my own midwives. I've been in midwifery since 2003, and in 2009 I was given the opportunity to take up a part-time post as a research midwife whilst I was working clinically for the rest of the week. And during that post I was given the opportunity to lead a discrete piece of research myself, and I've never looked back since. It's put me on a research pathway that's culminated in being awarded a doctoral research fellowship from the National Institute of Health Research, and the chance to address a research question that had bothered me since I was actually a student midwife. So my current role is my dream job. The role is all about setting up a centre of excellence for nursing, midwifery and allied health professional research, establishing a clinical academic career pathway and encouraging nurses, midwives and AHPs to lead research. I really want to inspire and support other nurses, midwives and AHPs to achieve what I've achieved if they want to, and also to bring research into clinical practice, into the heart of practice, rather than being something that somebody else does. So there have been some challenges along the way. For example, there are very few clinical academic career roles, and also research can take a long time to get into clinical practice, and that can be a bit demoralising sometimes. That's something that you have to accept as a researcher. However, the future looks really bright and exciting, and I wouldn't want to be anywhere else. Thank you.
Hello, I'm Rebecca Smith, and I've just recently retired. I was a midwife, practising midwife for 35 years, and my last position was at the University of Manchester. I was a senior lecturer in midwifery there. Looking back about what drew me to midwifery, I was a nurse first, and as part of your training, you did so many weeks as a placement on a maternity ward at the hospital where you were based. And that's when I was first introduced into midwifery and maternity care. And I just really enjoyed it. I thought it was just a different way of working in the NHS. Women weren't sick. They were healthy women. And it was more about, it felt it was more about supporting and guiding them through their pregnancy and also caring for their families. I just really enjoyed it. And I think we all realise and know that every woman always remembers the birth of their baby. So to be a part of that memory is really quite something. I've had different roles. I was a clinical midwife for many years. Then I moved into research, and I worked on a number of large randomised controlled trials, all to do with maternity. And then, as I said, later on in my career, I moved into teaching, but still was involved in performing my own research as well. But I've had a fabulous career, very fortunate, and would highly recommend being a midwife.
Hi, I'm Kim Wilkes. I'm one of the maternity support workers. I started an X-ray file in 2007 on agency. I applied for a data input clerk in 2008. I worked there collecting information regarding our local and surrounding maternity service users, trying to identify links into patient care and outcomes. It's through this job that I gained knowledge and passion to be more physically involved in providing safe and personalised care. I've been on delivery suite for I think it's past 9 years. We as support workers up here are involved in a lot of different caregiving opportunities, from basic obs to supporting women in labour and delivery. We can see normal vaginal deliveries, caesarean sections, forceps, manual removal of placentas, and we support families at their most vulnerable, happy or most heartbreaking moments of their lives. At one point, I found a huge passion of theatre, seeing and preparing patients for their elective surgery to have their baby. I felt I built up a good personal rapport with them and felt privileged to be there with them. It can also be very fast paced, especially when it's emergencies. When it is hectic, good communication is essential. My role over the past few years has been more focused on cleaning and preparing rooms for next patients. So my next step is to try and work in MAU on a more permanent basis.
Hi, my name's Tanith. I'm currently a maternity assistant on delivery suite, and my current level is a band 2. So I have qualified for MVQ level 3 and Maths and English whilst I've been at the trust. Currently I'm studying a foundation degree to be assistant practitioner at Birmingham City University. My inspiration to come and work in maternity was the love of seeing life being born and also enjoying having 3 children of my own. I've worked in the trust for 17 years, 5 of those years have been with maternity, and I've seen a massive growth in my experience. The challenges over the last probably 2 years has been staffing and COVID. To balance that out though, I enjoy helping all the midwives who will happily shout for me to come in and help with deliveries and supporting the parents in what is mostly a joyful situation. Thank you.
Hi everyone, my name is Catherine Anders and I'm currently a midwifery lecturer at the University of Manchester. I'm relatively new. I started at the University of Manchester in January 2021. Previous to that, I worked at Bolton as an advanced midwife practitioner and a prescriber. I was an advanced midwife practitioner since 2016. It had many challenges, but the benefits certainly outweighed the negatives. As an advanced practitioner, my role was to bridge the gap between the doctors and the midwives. As part of my role, I performed Kiwi deliveries, fetal blood samples, as a CTG expert, a prescriber, and predominantly my role was on delivery suite and maternity triage. I came to Manchester as I wanted to share my knowledge, my wealth of knowledge with the up-and-coming students in the future of midwifery. Thank you.
Hello, my name is Caroline Dixon and this is Janet Brown. We're both research midwives. We work at Leighton Hospital in Crewe. We've been in this role for about 10 years now and we're both senior midwives, band 7 midwives, and experienced prior to this as in all areas of midwifery. This has really been a natural progression for our career. Having a good basis before we started this has enabled us to take on a variety of different research projects and engage with the unit.
I was inspired to come into this role to make a difference for the future. I feel that our presence, the presence of research in the unit, gives our women additional choices and options.
I was inspired also because it was a new challenge and it brings a new dimension to my role and also enabled me to progress in different areas to learn more.
Working in research can bring its challenges. Initially when Carol and I were first in post, staff were wary about the research opening because of the additional pressures and workload it could bring to them. But over the years we have developed good relationships with the staff and they welcome research within the unit.
So for the future, I would like to see my role as Janet's too, as leading others and showing them the importance of research and continuing to build the evidence for future practice and also helping others in their research elements of their career and helping them move forward with that career and take bigger steps in the future.
Hi everybody, so my name is Lynn Dudley and I am the interim head of midwifery at University Hospitals of North Midlands. When I started nurse training way back in 1983, I always wanted to go into nursing, but I was also passionate about my gymnastics. Eventually I figured out that I did need to study to get into nursing. I had to work hard as academia didn't come easy to me. So after several years in orthopaedic trauma, I did commence my midwifery training. I absolutely adored my role in clinical midwifery, which was 1990 to 2014. I did actually take my only year out of University Hospital of North Midlands from 2002 to 2003, and that was my gap year in my late 30s. And I did that to check out midwifery in Australia by myself. So my main challenges have been balancing my love and passion for clinical midwifery with academia. Having been fortunate enough to complete my PhD in 2015, I then actually had the dilemma of what do I do next. So at the time, I just didn't want to let go of midwifery. So I entered the world of quality and risk management in obstetrics and gynecology, and actually I had no regrets. This allowed me to influence the provision actually then of safe services for our women, whilst continuing with my enthusiasm for evidence-based care. How does what I do make a difference to other people? So being with a woman and her partner at one of the most precious times of their lives has been such a privilege and rewarding experience that fills me with an overwhelming sense of pride for the profession. Helping them to achieve the best possible birth experience that they will talk about in years to come is an absolute honour. Equally, being able to support an incredible team of midwives, doctors, nurses and students to provide the safest care possible to our mothers and babies, but also look after each other, has been a huge part of my career. So what would I say to you, aspiring to be in a similar field of healthcare and who may have doubts about their ability to achieve their goals? Believe in yourself and your abilities. Determination and the desire to succeed will overcome any self-doubt. Never be afraid to ask for help. We all need it at whatever level we're at. And remember, together we are better. I left school with 5 O-levels, couldn't quite manage my maths, but went on to complete a multi-centre research study in England, and in 2019 received the Silver Award from the Chief Midwifery Officer for England for my services to midwifery. Thank you to my then head of midwifery, Sharon Wallace, for the nomination, and the incredible and inspirational team of healthcare professionals at UHNM for supporting me on my journey.
Hello, my name's Julie Escort, and I've had the privilege of working in midwifery services from 1984 when I started my training and completed my training after doing my registered general nursing. I did an obstetric placement and I knew instantly that this was something I wanted to pursue until 2017 when I retired as head of midwifery. So I've had a number of roles throughout my career, and each one kind of took me on a different pathway, all of which I've thoroughly enjoyed. And I think it's all about balancing your work-life balance. When my children were small, I was able to undertake a part-time degree course and have had the opportunities for lifelong learning, to be able to do other courses, things you feel passionate about and that brings additional skills to midwifery services. Things like aquanatal, hypnobirthing, coaching. I feel so privileged to have had the career and the opportunities that I've had. And I think the most important thing is that knowledge that you're making a difference to mothers and their babies and families. I think for me, if you're looking for a challenging, demanding, you're prepared to put in hard work, emotionally taxing career, and on the flip side of that, the rewards that you get back are incredible. I have had the most amazing career, and if this is something you're looking to do, then I would urge you just check it out. So lovely to meet you all. I wish you all the very best if this is something you pursue, and all the very best for the future.
Oops, here we go. So thank you very much, Dr. Hancock, and to your colleagues for sharing the diversity of roles and what the future looks like for such a rewarding career. Thank you very much for coming down with us today.
Thank you. It's been a real privilege, and thank you to obviously my friends and colleagues who, I know the video was a little long. We didn't manage to get any midwives from the ward areas, so antenatal, postnatal and intrapartum care, but hopefully what they've done is given some insight into the variety of roles and opportunities that are available in maternity care and the different routes in for people with different levels of previous academic qualifications.
Thank you.